Alright. So it is I have told you that via matter is connected to this inner, okay, inner dura matter. And remember that, and this dura matter, observe carefully, right? And this dura matter, which is present between the ventral root and the dorsal root. What do you mean by ventral root, right? What do you mean by ventral root, and what do you mean by dorsal root? Ventral root is nothing but these are the bundle of nerve fibers which is at the anterior aspect. Okay, what is dorsal nerve root? Dorsal root is the posterior nerve roots. Okay, so the dorsal root and the ventral root, remember that it is divided by this, right? Divided by this what? Divided by this dura mater. Divided by this dura mater. Okay, that's the first basic point you need to understand. So this is the basic which I have already discussed. And the next important point is it is an important landmark in neurosurgery. And why it is an important landmark in the neurosurgery? Because remember that behind the ligamentum, behind this ligamentum denticulatum, okay, now which I have told you, which you have already discussed here, where it is attached to the dura mater, where in front you have a ventral projection, back you have got a dorsal nerves. And remember that why it is an important landmark. Okay, why it is an important landmark for the neurosurgery? It is an important landmark because behind this ligamentum denticulatum, okay, you have got a dorsal root. Remember, you have got a dorsal root in front. Okay, in front of ligamentum denticulatum, you have got a ventral root. Remember that this is a ventral root. Behind what? Behind the ligamentum denticulatum, you have got a dorsal root. In front, before, right? In front of the ligamentum denticulatum, you have got a ventral root. So these two roots, and you need to understand this is an important landmark. Okay, right. So let us continue with the next important points. And what's written here? It's written that you have got something known as conus medullaris. And what do you mean by conus medullaris? It is an lower tapering end of spinal cord. Remember that. Okay, this is a lower tapering end of spinal cord. Sacral and the coccygeal nerves are arising from it. Only these nerves are affected in the conus medullaris syndrome. And next you have got something as cauda equina. What is cauda equina? It is a bunch of spinal nerves from L2 to the coccyx. Now, when I tell you it is a bunch, so you have got a lumbar, sacral, coccyx or coccygeal nerves are involved in the cauda equina syndrome. Now let us understand what is it trying to tell us. Now, this is what? This is a spinal cord. Okay, this is a spinal cord, right? These are the vertebrae. And observe carefully, this is a spinal cord. This is the lower end of the spinal cord, right? When I tell this is a lower end of the spinal cord, which is a tapering end of the spinal cord, this is like a cone, right? This is a cona medullaris. Okay, conus medullaris. Now, what are the nerves which are arising from this cona medullaris? You have got sacral nerves. Remember, this is a sacral nerve. Then you have an coccygeal nerves. These sacral nerves and the coccygeal nerves, these nerves are arising from the conus medullaris, right? And next you have got something known as, there is something known as cauda equina syndrome. Cauda equina syndrome. Now, what do you mean by cauda equina? Right? So it is a bunch of spinal nerves from L2 to the coccyx. Where is L2 here? This is L2. Okay, this is L2. This is L2. Now L2, L3, L4, L5, right? S1, S2, S3, S4, S5, right? And you have one coccyx. Now the bunch, these are the bunch of spinal nerves which are arising from the L2, which is from the L2 to the coccyx. So what are the nerves which comes? Lumbar nerve, sacral nerve and coccygeal nerves. These nerves, three nerves are involved. When I tell these three nerves are involved, right, in which syndrome is involved? it is involved in quad equina syndrome, because these nerves are these bundle of nerves, okay, which are arising from the L2. Remember, it is L2 to coccyx, right? Now that's a simple way of discussing the external features and the ligamentum, denticulatum, and cona medullaris, cona equina. So how many spinal nerves are present? Okay, the spinal nerves, you have around some 31 spinal nerves. Remember, 31 pairs of spinal nerves. How many vertebrae here? 33 vertebrae. So now the point comes here is, you got a 33 vertebrae, right? You got a 33 vertebra, and you've got a spinal nerve of 31 pairs. Now what's happening with this? Okay, so the spinal segments do not always correspond with the vertebrae. That's the basic points. The spinal segment do not always corresponds with the vertebrae. When I tell this sentence of spinal segments do not always corresponds with vertebrae, now what is the basic point here? This is a spinal segment, this is the vertebrae. Now the nerve which is coming from the C2, okay, C2, it has got the same level as the C2. That means this is a vertebrae of C1, this is a C2, okay. Now this is a spinal cord, okay. Now the spinal cord of C2, if you look into this, the level is same, okay, level. That means if I want to trace the C2 nerve, then I can easily trace at C2 vertebrae. Now say example in the lower cervical aspect of C6, now this cervical, the spinal nerve of C6, it is present at C5, that is one vertebrae above. That is one vertebrae above. Next we have got something known as upper thoracic, that is T5. Where exactly it is present at T5? It is T3, two vertebrae above. And you have lower thoracic, that is T10, which is of three vertebrae above. Now what does it mean? Okay, what does it mean? Now if I want to trace the C6 nerve, I will get the C6 not at the level of C6, at the level of C5 vertebrae. Okay, so as it goes down, remember, as the level go down, there is a difference of 1, okay, in the lower cervical of 1 vertebrae above. Upper thoracic T5, say example upper thoracic, that is T5, it is 2 vertebrae above, okay. In the lower thoracic, say example you have one T10, it is of 3 vertebrae above. So there is some difference with the levels of the spinal cord and the vertebrae. This basic point you need to understand. Now let us finish the session by speaking about the cut section of the spinal cord, okay. When I cut the section or the gut section of the spinal cord, when I cut the spinal cord, you have got nuclei in the cut section of spinal cord. What nuclei are present here? Okay, what nuclei are present? Now the